Welcome to Called to Care, the Harbor-UCLA Medical Center podcast. Today, we're talking to Dr. Carmen Mendez, the Associate Medical Director for Outpatient Care, about primary care. I'm your host, John Flynn.
What is it about Harbor that inspires you?
The patients. I really enjoy the patients that we serve. I believe in the mission of what we do at Harbor-UCLA as well as the mission of what we do in the county. And I really like the people that I work with here.
When people hear the word primary care, they tend to think about things like checkups, prescriptions. How do you define primary care? How should the public understand primary care?
Primary care is preventive health. When you come to your primary care physician, you should expect to hear all of the things we can do to help prevent diseases, control diseases, and help you stay healthy. That is the mission.
So what's the difference between coming to the doctor when something feels wrong as opposed to having an ongoing relationship with a primary care provider?
There's nothing wrong with going to the doctor just when things feel wrong. I do think, though, the benefit of seeing your doctor when you feel well is that it allows your doctor to get to know you better and to understand kind of what your view is of health, what your view is of how you want to live your life, which is a little bit harder sometimes to discern when someone doesn't feel well. It's the difference of when someone gets admitted to the hospital and they're feeling really sick and we're trying to understand how they approach healthcare. In that moment, it's really hard to figure that out because they don't feel good. But when you see someone and they're feeling well, you can have more meaningful discussions about how they approach their health, what's important to them, how they want to live their life as they get older, and you just get a better understanding of your patient so that you can give good advice.
Can you give some examples, maybe from your personal practice, of the sorts of health issues that you can catch in that sort of a relationship?
Well, routine things that we do in primary care is all the cancer screening that is recommended, as well as all of the immunization recommendations that come out to prevent infections, and sometimes even immunizations that have come out to prevent cancers, right? These are all things that we provide to people even before they get sick. We also do a lot of screening exams to determine if you are at risk to get some type of chronic disease, which maybe you seem really healthy right now, but when we do some tests and screening exams, we discover like, oh, well, no, you're at really high risk for coronary disease because of your past medical history and your cholesterol levels and all these other things. And we would have some advice or recommendations that we give you to help you prevent you from having a heart attack.
I would guess you could see trends as well.
Yes, you can follow trends. You can follow just overall health metrics like weight, blood pressure control. All of those things are things that we measure when you come into the primary care clinic.
Can you give some examples of interventions you've been able to do because you had a good primary care relationship with somebody?
I think every day when I go down to clinic and see patients and we do a screening mammogram and we find, recently, a couple of weeks ago, I did a screening mammogram and they found a breast lump, and the, breast clinic continued to work up the patient got a biopsy. It ended up being a benign lesion, but all of those types of things are found because you come in and you just do the routine recommendations that we have around screening. Don't come in and do those things. Then we only find out you maybe have cancer when you come in with cancer.
Are there other sort of long-term things that you see? You mentioned cancer a couple of times.
That one I mention a lot because that is the one I feel like we are probably saving the most lives with when we actually prevent cancer versus when we see it in the inpatient setting, which I see very frequently. But, vaccinations are a really great one, and during high seasons of flu, coming in and getting your flu vaccine prevents you from, potentially getting flu, or even just decreasing the amount of time that you're sick, or more importantly, maybe passing on the flu to someone who can't tolerate getting sick. So I think immunizations are very important. I think one of the things that I do probably most often with patients that people don't think about as much is just kind of like your general wellness checks with, trending your weight. Are you gaining weight? Are you losing weight? Trending how well you're doing with your own personal kind of goals you have for your health that you have set of things that you want to achieve. And, patients do have those over time as they develop relationships with you. you begin to kind of learn them and kind of what's important to them and what they want to keep watching or what they're afraid is going to happen as they get older and want to prevent. So I think it is a very personalized relationship that it does take time to grow. Like, you don't learn someone in a 20-minute visit the first time you see them. You have to see them many, many times to kind of understand them and what is important.
Let's talk about Harbor more generally. What does Harbor offer, both in terms of primary care and then perhaps in terms of overall care? Like, somebody who doesn't know this hospital, what's the scope of those two things?
For outpatient specifically.
Yes, for outpatient.
So we offer full scope primary care. If you're a patient and you become a Harbor primary care patient, you get your own primary care provider assigned to you that you can come and see. We offer all of the normal preventive health screening. We manage all of the traditional chronic diseases like diabetes, high blood pressure, high cholesterol. And we also have a very diverse specialty clinic experience, and we can refer patients to specialty services if they need that as well. We have all of the radiology services that you need if you needed a CT scan or a chest x-ray. All of those things are available to you if you are a patient here.
There are a lot of specialties on this campus.
There are a lot of specialties on this campus.
Some patients, as you were mentioning just a minute ago, avoid primary care because they're busy, they're nervous, they're uninsured, or they're unsure where to start. Let's assume one of those people is listening to us right now. What would you tell them about making an appointment?
Well, if you already are a patient and you just have not made an appointment to see us, just encourage you to come in and make an appointment. I'm also a patient who sometimes is really great at making my preventive health appointments, and sometimes I'm not. And I understand, I'm a busy person. People are busy, life and work and kids. But it does help to prioritize at some time during the year. I usually will tell patients, like, pick a month during the year where you have the highest likelihood of making an appointment. For me, that month is May. That is my designated month where I will go and try to do whatever I'm due to do for preventive health during that month. So I would just encourage people to remember that this is the only body you have. It's really important to take care of it. And just pick a time in the year where you think you have the highest chance of doing that, and do as much of that as you can.
We're recording this in July. Many children are out of school right now. It would seem
Yes.
that's probably. So can you talk about children in primary care and maybe taking advantage of this moment?
Absolutely. I have 4 kids, for people who don't know, and I picked the month of August as the month where I just did this actually a week ago, got online to our primary care doctor that we haven't seen in a year, and I made our appointments for our annual exams in August, where I take the kids and we just go for the checkup, go do the things. Before school starts, before things get too busy, before you have to pull kids out of school, it becomes really complicated. Just pick the time where you know you're most likely to get in there and go in. It's important for the kids to get their vaccines that are due, not miss the time frames when those things are due, and then you have to catch up or you just don't do it at all. I think as someone who has kids that are over the age of 5, that is a time when people start to go to the pediatrician less unless they actually have illness, but it's still really important to do yearly checkups or yearly physicals in pediatrics because there are still things that are due for kids after they start kindergarten.
Can you give some examples?
The HPV vaccine, that is due for boys and girls after the age of 5, prevents cancer in girls and other illnesses in boys. Getting up to date on the tetanus vaccine, that's due after the age of 5, and it will become a requirement when they get into junior high that they have to have it done. So you might as well just stay on track. There's just lots of different vaccinations that still come up in those preteen and teen years that kids still need to receive.
I hear you saying that you want to have kids come in just for a look-see and also for vaccinations. Are there other things, like as a parent maybe who doesn't know much about the medical system, that I can expect to encounter in that visit?
Most of it is just, the vaccinations and the physical. But I do think as kids become teenagers, I know recently I got my daughter, who's 13, back plugged in with a pediatrician just because I want her to have another adult that maybe she feels she can ask health questions of. She could obviously ask me, I'm a doctor, but maybe she's not going to want to ask me. And so having another physician who she could go to and ask whatever questions she has is important for her.
What I hear you saying too is that trust relationship is something that it's important to establish. It's like you don't want to be coming in just when you're panicked. You want to be coming into someone when you're panicked that you trust.
I think it's good too, as the kids are preteens and teens, that they start doing that so that when they become young adults, they have good patterns. They already know, like, oh, I have to get a primary care doctor. I have to see this person once a year, and I have to keep doing, my health exams. I see a lot of patients, and I'll see them in their 30s, and I'll ask them, oh, when was the last time you saw a primary care doctor? And they're like, oh, I don't know, probably not since I was a kid. Yeah, that's very common. And I think it's just, it's not necessarily bad, but it's good to just be in the habit of seeing someone routinely.
Yeah. I mean, when you get to 20, it's easy for it to get away from you. That and your dental care, I think.
Oh, yes. Yes. I just told all the residents that started here, make sure you go to the dentist.
Right. So we've been talking about kids. We've talked about ourselves. What age range of people are seen at Harbor?
We see children from birth until up to 100 years old, however you live for. We actually have a specialized geriatric primary care medical home here. And it's very unique in that it does specialize in seeing patients over the age of 65 and addressing the core needs of the geriatric population, which is amazing. And they provide amazing services here for our patients.
What is one practical step listeners can take right now to prioritize their health or their children's health through primary care?
Pick a month that you're going to dedicate to your primary care evaluations. I think that's one practical thing you can do, and do as many of those things as possible. Like you mentioned, it's not just the doctor here, it's also the dentist. Go to the dentist, go to the eye doctor, and go to the primary care physician. Like, all of those things are important. I think the other one is probably just trying to stay as informed as possible about what preventive health things you are supposed to be getting as you get older. I don't think oftentimes patients even really know what are the screening things you should be doing as you get older. And then I think the third one is, if you go to your primary care doctor and you have questions you want to ask, write them down before you go, because you so often get in there and we're talking about all our stuff and all the things you want to do. And it's a lot of information, and you may forget the things that you had questions about that you wanted answers to. And those things are important. And so you need to write them down so that you make sure to ask all your questions as well.
I've noticed my provider has taken to asking for 3 things.
Yes.
It's like, make that little list, the 3 things you want to talk about.
Yes. I will sometimes message my patients if I know they're very active on our patient portal, I will message them ahead of the appointment and just ask them, like, let me know the couple of things you wanted to talk about today so I can just be prepared. Or message them the week before. Let me know what you want to talk about so I can make sure I have information for you.
Great. Now, you mentioned the patient portal. What is Harbor doing to make it easier for people to stay on track with care?
Patient portal is definitely one of those things. You can self-enroll for the portal, or you can come in for a visit and get assistance, and we can help you enroll in the portal. The portal allows patients to see all of the labs that they have drawn, some of the studies that we do, the notes that are written, so that they have easy access to information. And it also allows you to message the pharmacy if you need refills of medications, and to directly message your primary care provider. It's probably a lot easier than playing, phone tag with your provider. You can directly message, and then we message you back. We answer the questions as best we can if we think we can do that on the portal.
Now, let's assume I'm a person in the community who only knows that Harbor has a big emergency room, and that's the only interface I've ever had with it. I'm listening to you telling me that I should see a primary care provider. I have no idea how to get to that person. How do I get to that person? How do I find that person?
Well, if you currently have Medi-Cal, then you would be assigned to a physician. If that physician is at Harbor, then the easiest way to get a hold of that physician or make an appointment is to call the phone number, and they can make you an appointment. If you are uninsured, but you still want to receive primary care services, you definitely can self-refer. You can walk into the hospital, go to our patient relations office and request to self-refer. There are things that the office will do for you in terms of having you, go to patient financial services, see what programs you might qualify for. But there are ways that you can still get a PCP when you're uninsured without having to go through the emergency room to do that. So the other option you could have if you did have an acute issue and you didn't have insurance, but it wasn't life-threatening, is you would go to our urgent care, get that issue managed, and they would also direct you and kind of help you get a primary care physician.
Can you share what's going on with the campus, with these buildings that we see rising?
We are opening our outpatient building predicted on September 22nd, 2026, if all goes well. We are extremely excited. All of our primary care services and our specialty care services will be in one space, which is going to just provide a lot better care for patients, seamless interactions for patients in terms of their visits and the physicians being able to communicate about their care. That center also has a new outpatient pharmacy, lab, radiology services, as well as a new outpatient physical therapy gym, which is going to be amazing. So we are really excited to move into the new space. We think our patients deserve to be seen in a space that's beautiful, and we can't wait for them to see it.
And since we're in Los Angeles, I have to say, it also has excellent parking.
It has excellent parking.
So final bite at the apple. Do you have any final advice for our listeners about their health?
Go see your primary care doctor, or go find one if you don't have one yet, and have a relationship with someone. It can be really helpful for your long-term health.
Thanks for joining us. Visit the Harbor-UCLA Medical Center YouTube page or find us on Spotify to hear all of our podcast episodes and more.